How common is OSA in heart failure patients? Have you ever wondered how sleep apnea might affect those with heart failure? Obstructive sleep apnea, often referred to as OSA, is surprisingly prevalent among heart failure patients. Research indicates that the occurrence of OSA in this group ranges from 40% to over 50%. This variation largely depends on the specific type of heart failure and the population being studied. Heart failure can be categorized mainly into two types. The first is heart failure with reduced ejection fraction, where the heart muscle struggles to pump blood effectively. The second is heart failure with preserved ejection fraction, where the heart is too stiff to fill with blood properly. In both categories, OSA is notably common. For instance, studies show that OSA affects approximately 48% to 52% of individuals with either type of heart failure. This suggests that nearly half or more of heart failure patients also experience OSA. In earlier studies, OSA prevalence in patients with reduced ejection fraction was estimated at around 12% to 15%. However, more recent findings reveal much higher rates. One study discovered that among heart failure patients classified as New York Heart Association Class 2 to 4, about 71% had sleep apnea, with 35% specifically diagnosed with OSA. Another significant study reported that 76% of patients with moderate to severe heart failure experienced sleep-disordered breathing, with 36% having OSA and 40% having central sleep apnea. The presence of OSA in heart failure patients can lead to worse cardiovascular outcomes. The repeated airway obstruction during sleep causes intermittent low oxygen levels, increased activity in the sympathetic nervous system, and disrupted sleep. These factors can negatively impact heart function by increasing the resistance the heart must pump against, impairing oxygen delivery, and promoting irregular heartbeats and high blood pressure. Therefore, identifying and treating OSA in heart failure patients is essential to potentially improve symptoms and reduce cardiovascular risks. In clinical settings, it is advisable to screen for OSA in heart failure patients, particularly those exhibiting symptoms like excessive daytime sleepiness or suspected sleep-disordered breathing. Polysomnography, a comprehensive sleep study, is the preferred diagnostic tool for this population. Simpler home tests may not reliably detect the types of sleep apnea that are common in heart failure cases. Treatment options include continuous positive airway pressure therapy, which helps keep the airway open during sleep, and lifestyle changes such as weight loss. Addressing OSA in heart failure patients can enhance their quality of life and may lower hospitalizations related to heart failure. In summary, OSA affects about half or more of heart failure patients, making it a common and clinically relevant condition in this group. Its presence can worsen heart failure outcomes, so awareness, diagnosis, and treatment of OSA are important components of managing heart failure effectively.